Okay, so what we're gonna do, especially with you being brand new, we're just gonna go over the basics of Medicare. We're gonna use a screen. I'm gonna show you my screen to go over the Medicare and You guidebook, which you've been reading, and we're actually gonna use only one page of that book, which summarizes the whole book. Take notes. My YouTube videos have me explaining how Medicare works, I believe, but this is a more in-depth version. But I also need to talk about enrollment periods, because there are certain times of the year that we can do something, and there's times of the year that we can't do something. And so today we're gonna talk about the basics of Medicare, and then we're gonna talk about enrollment periods. Just so that way, because you're gonna be dealing with my existing clients, but if an existing client says, I need help with a drug plan, you'll know based on these enrollment periods that no, I can't right now, right? So that's what we'll talk about today, which will take about an hour. And then tomorrow we will talk about actually the systems that I'm using, the CRM, the list of my clients, what to look for, how to work the systems. That's day 2. And then day 3, and then day 2. So tomorrow we'll actually also set up like Nextiva and make sure that works on your phone. So we'll actually set up everything, because some stuff has like 2-factor authentication. So I want to make sure that you can just log in effortlessly. You'll have your own login, you'll have your own password, but you'll still be able to see the same stuff that I'm saying. Let's see what else. And then hopefully on Wednesday, so that's tomorrow, and then hopefully on Wednesday, we'll actually get you on the phone talking to somebody. So you'll listen to me talk to a client, and then I'll hand that over to you. Well, you'll listen to me do a couple, and then I'll hand that over to you so that way you can just run through it. And the whole idea is to uncover the people who don't have a policy with us anymore, to try to get them back. And then those that do have a policy with us, try to get referrals from them. And I'll show you how to do all that stuff.
Okay.
All right. So, and then after that, after a couple weeks of you doing that and us listening to calls, and you and I will talk every day before you get on the phone and all that stuff. And then after that, we'll be working the leads that I'm going to provide for you.
All right.
All right. So let me share my screen. So this is the Medicare and You guidebook that you've been reading. And you said you're on page 60 or something like that?
About page 40, yeah.
40, okay. It's good bedtime reading if you're bored.
Yeah, no kidding.
So it talks about, Medicare Part A and Part B, blah, blah, blah. So it does talk about some enrollment periods here. We're going to talk about that later. Right now, we're just going to talk about this page right here, which is your Medicare options. And so also notice, so the way that I'm going to explain this to you is how I try to explain it to somebody who is new to Medicare but doesn't understand what to do. And so what happens, and I'll stop sharing for just a second. What happens is people get hundreds of phone calls every single week. Hey, I want to sell you something. Hey, I want to sell you something. Hey, let me come see you in person. Hey, let me schedule an appointment with you. I mean, it's really, 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 really bad. Probably anywhere between 15 to 25 phone calls every single day they get of somebody trying to sell them something regarding to their Medicare enrollment. And they're after their health insurance, which is Medicare, and they're after their life insurance, they're after their 401ks, they're after all that stuff. And the problem with that is everybody's trying to sell them something, and nobody's really taking the time to actually educate them on how Medicare works. So here, we're actually going to talk about Medicare as if you're educating decline. And for example, there's Medicare Advantage, which means nothing to you right now. There's Medicare Supplement, there's Medicaid, there's VA benefits, TRICARE for Life, etc. There's so many different benefits. And the question is like, well, how do I know what I need? Like, you're trying to sell me a product, but how do I know that that product is good for me, right? And they don't. Just off of a sales pitch, they will not know. They will only know if you do a needs analysis, which actually is a very good word, a needs analysis, which is we take the time to first educate you on how it works and then show you how it works with your situation. And we learn about your situation through a needs analysis. Hold on a second. Sorry, I just gotta answer this question.
It's all right. Taking some notes.
Okay, so I'm gonna talk to you as if you were one of my clients and I'm explaining to you how Medicare works. So let's go to the chat, or excuse me, not chat, let's share screen. So this is Medicare in a nutshell. And what I like about this is, for the most part, this summarizes the entire book. It summarizes their entire options. And so the first big decision that a client has to make is whether they stay on original Medicare or if they go to a Medicare alternative known as Medicare Advantage, which is also managed by Medicare, and it gets a little confusing, but we're not going to go into it that deep just yet. Do you understand, do you know what Medicare is?
Generally speaking, you know, consisting of like the hospital insurance, medical insurance, and then so their Part D coverage being their drug insurance, and then like you said, Part C kind of bundles it all together for that Medicare Advantage.
Wow, that's really good.
Thank you.
So yes, you must have been watching some of my videos. So yes, but Medicare, even more generally than that, Medicare is insurance that you get in your senior years.
Okay.
Or if you have a disability. So some qualifications for Medicare, because not everybody gets Medicare. Very, very few people do not get Medicare, but we'll talk about that here also. You have to have worked a minimum of 40 quarters in your lifetime in America in order to qualify for Medicare Parts A and Parts B.
Okay.
If you've worked less than the 40 quarters, you will have to pay for Part A.
Okay.
But most of the time, Part A is at no cost when they turn 65. However, in some cases, if a person, let's say, is 30 years old and they get a disability of some kind, they can't work anymore, right? Because I said 40 quarters is the qualification, but at 30, what if you haven't, what if you didn't qualify the 40? Whatever happened, you're disabled. Once you apply for disability, which is through Social Security, saying that I'm not able to work, once you get approved for disability and you've been on disability for 24 months, on the 25th month, their Medicare will start.
Okay.
And that's their Part A and Part B.
Got it.
So there are, if you want to do some homework, learn how to qualify for Medicare. So disability, like renal failure is another one. If your kidneys are going out. If you're so disability, renal failure. So there's some different qualifications other than the two that I mentioned. But the two most popular are either they're turning 65 or they have a disability. In most cases, and in this case, we're just going to assume that they're going on Medicare at the age of 65. So once they go on Medicare, they will get Part A at 65, regardless of whether or not they continue to work. If they've met the requirement, because some people choose to work beyond the age of 65, and they'll still get Part A. It will just be their secondary insurance to their work insurance, which would be their primary if they have it. The Part A covers hospital insurance, so that's anything inpatient. Do you know what the word inpatient means?
Yeah, when you're admitted into the hospital.
Admitted in, yeah. That's Part A. Emergency room is not an admission to the hospital. Emergency room is actually outpatient. Then Part B, so and Part A is free or no cost. It's really not free because you've paid for it through your taxes. But Part A is at no cost, assuming you've worked the 40 quarters. Part B, okay, so Part B is your medical insurance, which is like doctor's visits, preventative care, lab work, x-rays, et cetera, et cetera. Part A and Part B are considered original Medicare. So on this piece of paper, original Medicare is really only Part A and Part B. That does not cover drug benefit. That does not include drug benefits. That does not include dental. That doesn't include any of that. All that is separate. In addition to original Medicare, Part B has a deductible. It's $223. $233, excuse me. I was writing 2023 and it said that. So now that Part B deductible changes every single year. And so this year it's 233, next year it could go up, it could go down, et cetera, et cetera. Excuse me. Part B also has a premium. In this year, it's $164.90 a month. So Part B right here costs $164.90.
Okay.
So when you go on Medicare and Part A is free, Part B will get deducted out of their Social Security check for $165. Or if they don't draw Social Security, they'll get a bill in the mail for the $165. That's their insurance. They have to pay for it. Now, maybe put on your notes homework and read about Part A and what it covers, like as far as like deductibles and copays and et cetera, et cetera. I'm not going to go into that right now, but I will cover it tomorrow. So that's going to be your homework.
Okay.
And then same with Part B. You want to learn the details of it, but I will go over the general information right now. So generally speaking, if something was to happen to you medically and you have Parts A and Parts B, you'll roughly pay about 80% of the bill. And the reason why I say roughly 80%, because it changes if you're inpatient versus outpatient, et cetera, et cetera. But let's say you're outpatient and you have cancer. What's going to happen is you're going to meet your deductible first. which is $233. And then once you've met that deductible, Medicare, original Medicare, will pay about 80%.
Okay.
And so if all you have is Part A and Part B, no drug benefits, no supplement, no nothing, you will pay 20% of the bill of
Got it.
whatever the bill is. So if the bill is $500,000, you're out of pocket $100,000. So that's why most people that we talk to have some kind of secondary coverage to their original Medicare, or they go to a plan that is an alternative to Medicare called Medicare Advantage that bundles all their benefits and limits that 20% that they would have paid if they just had original Medicare down to a certain maximum for the year. And I'll explain what that means in just a second. So any questions so far?
So far, so good.
Okay. So going back to original Medicare, a supplement helps pay the 20% or whatever supplement you pick, whatever percent you choose, helps pay your out-of-pocket instead of you having to pay for that out-of-pocket. So you pick a plan like Plan G, for example, you pay the monthly premium for Plan G, and everything is covered at 100% after you met your deductible. So you will always have a Medicare deductible. So you're always going to pay that $233. But then depending on what secondary coverage you have will determine how much of that is covered. And so page 75 talks about the 10 different Medicare supplements. These are all secondary benefits to original Medicare. They supplement, right? They help pay in addition to Medicare, which we'll talk about these here in a bit. So that's optional. Part D is prescription drugs. The way that you shop for a prescription drug plan is based on the medications that you have. So if you take 4 medications, blood pressure, cholesterol, diabetes, and heartburn, for example, your recommendation may be different than, let's say, if I take only a cholesterol medication or an asthma medication. And so we have a system, which I'll show you what that is, that when you talk to a client and you say, okay, well, tell me about your medications that you're taking, they give you a list of their medications, their dosages, and their pharmacy that they use. We put all that into a system, and then that system spits out, here's the top 3. It shows you all of them, but it organizes them from lowest price to the most expensive price or out of pocket to that person. Now, notice what I said about supplemental coverage being optional. So the person can take a risk. I'm not going to pay that $120 extra on the Medicare supplement. I'm just going to risk it and have A and B. If it's optional, I don't want to take that option. The chances are, if you're going to be talking to that person, they're not going to go that route. If they don't want to pay anything in addition, they're better off going with the Medicare Advantage plan. I'll explain in just a second what that is. Excuse me. So, what is not optional is Part D. If you do not take a Part D plan, let's say you don't take any medications at all. So like right now, I'm on 0 medication. Like, well, why do I need a drug plan? I'm not taking it, right? If I don't take a drug plan, I will be penalized for not taking a drug plan. And that penalty, so let's say I'm like, I don't want to have a drug plan for 4 years. Or I'm going to pay for a drug plan when I need medications, right?
Mhm.
A couple issues there because you can't sign up for a drug plan whenever you want, which we'll talk about enrollment periods at a different time. But the other thing is that penalty, it's 1% per month for every month that you did not have a plan of the average monthly premium. So 1% of $35, which is the average monthly premium, is 35 cents. 35 cents, 1% per month for every month you don't have it. So 4 years is 48 months.
Mhm.
So 35%, 35 cents times 48 months. So that's $16.80 a month that will be added to whatever their monthly premium is on the Part D plan. So let's say the Part D plan is $20 a month. Now they're paying $36.80, and that penalty is for the rest of their life. It never goes away. The reason why they do this, let me tell you the reason behind it, is if Medicare, these drug plans, only consisted of, if these drug plans only consisted of people who have a condition, who are sick, who are using it, right? So all the health people say, no, I don't want it. And only all the sick people, I don't say that we're sick because you could be on medications and not be sick, but all the people that were using the insurance had a plan. What would happen is it'd go bankrupt very fast. So they need the healthy people who don't use their insurance. They need their money to keep the cost down of the people that actually do use their insurance. So if you look at Medicare, let's say 30% don't use it, 60% do use it. These 30% and the premiums that they pay help offset the cost of the people that actually do use the insurance. So that's just like the backstory behind that. So original Medicare is Part A, Part B, Part D, and then a supplement plan, if somebody wants to stay with original Medicare. So let's talk about the benefits of original Medicare. Not the actual benefits, but like the benefits of having original Medicare. So one thing is the network, the access to doctors is the biggest in the country. You can go to any doctor, any hospital, anywhere in the country that accepts Medicare, and you will be covered.
Mhm.
The supplement plans work the same way. As long as the doctor accepts Medicare, they will also take that supplement. It doesn't matter what company you're with, what supplement you have. So I showed you the 10. It doesn't matter. And that, again, that's like 95% true. I'll go over to the weird situations later. Like you don't need to know that stuff right now, but there are in some cases where you do have network participation requirements, but we're not going to go into that. Those are very, very rare. But in most cases, any doctor, any hospital, anywhere in the country, if you leave the country, you'll have foreign travel benefits. You can go to like the Mayo Clinic too. So there's a lot of hospitals that accept Medicare that may not accept other insurance. And some of like the more prestigious ones like cancer centers and all that stuff typically will accept Medicare, which means that you have the flexibility to go use your insurance however you want to. That same flexibility does not apply towards Medicare Advantage. And it does not apply towards employer coverage if somebody decides to keep their retirement benefits at work. So original Medicare gives somebody the most flexibility. But it's more expensive. Because in addition to your Part B premium that we talked about, which was how much?
Was it 233 or was the deductible?
That's the deductible. So what is the premium?
Was it like 165 or something?
Yeah, 164.90, 165. Yeah. So in addition, because remember that 164.90 you will always pay.
Mhm.
Regardless of what option you go with, whether you go with original Medicare, Medicare Advantage, you'll always pay that Part B premium. The only time you don't pay that Part B premium is if you're low income. So like Medicaid, which we'll talk about later. That's a whole different like week's worth of topic right there, but we'll not talk about that right now. So when the stuff that I say, those are all general rules, like the most popular thing that happens that we see, but there's a lot of stuff that happens in the gray area that's not as popular that you need to know about. But for us to get on the phone by Wednesday, you don't need to know any of that stuff. All right. Any questions about original Medicare?
You know, you basically covered most of it, so
All right.
yeah, we're good.
All right. So that's the first option. Somebody has the option of staying with original Medicare and then getting all this secondary stuff, or they can forego original Medicare and go on Medicare Advantage, which is, for lack of better words, an alternative to Medicare.
Mhm.
Now, every Medicare Advantage plan has been approved by Medicare, so they are Medicare approved plans. Some random Joe Schmo can't say, oh, I got an insurance plan, let's call it a Medicare Advantage plan. They can't do that. Everyone has to be approved by Medicare. But they are, unlike original Medicare, which is government,
Mhm.
Medicare Advantage is from a private insurance company.
Got it.
But it is Medicare approved. And typically a Medicare Advantage plan. So with original Medicare, Part A is separate, Part B is separate. Supplemental plans are separate, all that stuff separate. Hold on a second. My coffee is here.
I made it.
You want to say hi to Jason?
I got distracted. Hi, Jason.
Hi, Marina. How are you?
Good. Good to see you.
Good. Good to see you too.
I'm gonna go.
Long time no see.
Lila, you want to say hi? Come here.
Yeah.
I just want to show you what's on my computer. Come here. She said no. She said no. It's okay. She screams on the top of her lungs like somebody's cutting her, but she's laughing the whole time. Because she's a manipulator, just like her dad.
That's funny.
Okay, so original Medicare, Medicare Advantage bundles Part A and Part B, whereas original Medicare keeps it separate. A lot of the time, you don't have to pay for Medicare Advantage.
Okay.
So even though it's private insurance, it's offered by company, these companies actually get paid by Medicare
Got it.
to insure you. The reason why they do that is because Medicare knows that it's cheaper for them to pay Medicare Advantage to insure you than to pick up the bill themselves. And so these companies make a contracted amount, let's say $1,000 a month or whatever, to insure somebody. But if you do the math, just side note, $1,000 a month is $12,000 a year.
Mhm.
And the life expectancy of somebody right now, what's the average of on a man, is like 72.
Yes, that's what I read last time. Yeah, that sounds right.
So that's after they go on Medicare, that's 7 more years. That's the average. So 12,000 times 7 is $84,000. So let's just round it up to $100,000. Medicare knows that all they'll ever be out of pocket is $100,000 for the rest of somebody's life to insure them, versus one heart attack is $350,000, not including all the maintenance that comes after having a heart attack. So Medicare, in order to stretch their dollar further, said, hey, Medicare Advantage company, we'll pay you to insure these people. We'll let you make the rules, but any rules that you make, in terms of like coverage, how much coverage they have, any rules that you make, we have to approve them first. So you can't just say, oh yeah, give us $1,000 a month and we won't cover this person, right? So there's certain rules that they have to follow to cover this person. So Medicare Advantage bundles Part A, it bundles Part B, it bundles prescription drug coverage into one plan. Then these Medicare Advantage plans also, a lot of the time, not all the time, but a lot of the time, will include extra benefits. So original Medicare, remember I told you how it does not include dental, you have to buy that separately. A lot of these Medicare Advantage plans include dental as part of their benefits, and these people don't pay anything extra for it. So then what's the catch? Okay, well, Medicare Advantage so sounds really, really, really good. It's can't use the word free, it's no cost, right? Has dental, it has drug benefits. I don't pay anything extra. What's the catch? There's a catch. These plans are very network driven. So if you choose a Medicare Advantage plan, you have to make sure your doctor's covered. If your doctor is not covered, you may need to go on a different Medicare Advantage plan. Or if, let's say, your doctor doesn't take Medicare Advantage plans at all, which happens quite often, you might need to find a new doctor. Especially if you can't afford a supplement, right? An extra, because remember, with the supplement, any doctor, any hospital, it's covered, right? But it's an extra 120 a month. What if that person can't afford that extra $120 a month, right? So that's the first part. The second part is so let's say your doctor does accept the plan. The network is still limited. You may not be able to go to every hospital in your area. You may not be able to go to every hospital in the country, which is actually most of the hospitals will not take these Medicare Advantage plans outside of your local area where you buy it. So when you shop for Medicare Advantage plan, and I'll show you how I actually shop for supplements and Advantage plans for people, we shop them based on their zip code. And then we check each doctor to make sure they're covered or not covered. So I'll show you how that works here in just a second. Some Medicare Advantage plans, in addition to having a zero premium, and notice how I'm saying zero premium, I'm not saying free. We can't use the word free when it comes to Medicare Advantage. Even though it says zero and zero is free, free is zero, Medicare does not allow us to say the word, this Medicare Advantage is free. So this Medicare Advantage is of no cost to you, it has no cost, right? And the reason why it's not free is because Medicare Advantage gets paid. It just doesn't get paid by you, it gets paid by the government.
Yeah.
Anyways, some Medicare Advantage plans. So remember we talked about how you will always pay that $164.90 or whatever the premium is at the time, because that premium fluctuates every year. Some Medicare Advantage plans will actually pay you money to choose their plan.
No kidding.
So they'll say, out of that $164 that you're paying, we'll give you $70 a month back. So now you're paying, you know, $20 or whatever, $70 less. So is that 120, whatever the math comes out to be. So they do that because they know they make such a big amount of money from Medicare that they have some flexibility to incentivize people to choose their plan. But what happens with Medicare Advantage plan, have you heard of the term, you rob Peter to pay Paul? Or you jerk the dog to feed the cat?
I heard that one.
Okay. So what that means is to get a lot of benefits here, you're going to sacrifice benefits somewhere else. There's always going to be a give and take. And us as the professional needs to be able to not only educate the client on the different plans, but we need to have them understand that, hey, yeah, you're going to get all these extra great benefits, but your dental is going to be terrible. Or your dental is going to be really, 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 really good, but you might have a higher maximum out of pocket. Which brings me to the next point of how you choose a plan. So in addition to networks and doctors, medications is another one. Just like the Part D plans, you want to make sure that those medications are covered by these drug plans, by these Advantage plans. With original Medicare, you can have a separate plan for your supplement and your Medicare and a separate plan for your drug plans. That's how it works. And you'll know that all your doctors are covered, and then you know that all your medications are covered. In some Medicare Advantage plans, because it's all bundled, you may have a plan that covers all the medications, but not all of your doctors. Or it covers all of your doctors, but not all of your medications. And so that's kind of the decision that somebody has to make. And so when we search for a Medicare Advantage plan, we're looking at their medications first, medications and doctors first, and then all the extra benefits second. Because you can have a plan. Oh, let me go into the next step. Then once you've determined what's covered and what's not covered by the doctor and the medications, the next thing is we choose it based on what's called maximum out of pocket. It's a very important term. We abbreviate it. Insurance agents love abbreviations. It's called MOOP, M-O-O-P, maximum out of pocket. Between insurance agents, with hey, what's the MOOP on that plan? You're not going to talk like that to a client. But the point is, once you determine doctors are covered, medications are covered, let's look at those plans and pick a plan on the lowest maximum out of pocket. But in some cases, a client might say, well, I'm healthy as a horse. The only thing I ever use my insurance for is dental. I'm okay with the maximum out of pocket being higher because I'm never going to use this insurance right now, right? Because my health's good. But I want more dental. So they're robbing Peter on the dental and paying Paul on the higher out of pocket. So Medicare Advantage, you choose on doctors, medications, maximum out of pocket.
Got it.
So that's the biggest difference between original Medicare versus Medicare Advantage. It's Medicare Advantage, there's a lot more moving parts into picking a Medicare Advantage plan than there is with original Medicare, but original Medicare is more expensive. So again, the same thing. So now the biggest decision that somebody has to make is, can they afford original Medicare with a Medicare supplement? Or is Medicare Advantage a better fit for this person? So once they've made that decision, then you know how to actually shop for a Medicare a supplement, if they want to go with that route, or for a Medicare Advantage plan. Any questions on that?
I don't think so.
Nope. Cool. Let's do this. Let's end this call. I'm going to render this video and I'm going to name it. We're going to hop back on. We're going to spend 20 minutes talking about how to shop for a Medicare supplement and a Medicare Advantage plan. Okay. And then we'll actually do enrollment periods a different day. Because it's all part of the same topic. So let's jump off here. I'll text you when the new link is in your email. It's going to take like 3 minutes for this to render. Okay.
Okay, sounds good.
Yep. Bye.